Hello, I'm Dr. Ayush, and in today's short video, we are going to see about emergency drugs. So this drug which I have in my hand is Noradrenaline. Its first line indication is septic shock. The mechanism of Noradrenaline, it acts on alpha-1 receptor and beta-1 receptor. It does not act on beta-2 receptors. That's why it increases BP. And adrenaline acts on alpha-1, beta-1 and beta-2. So it also acts on beta-2 receptors, which causes bronchodilation, and that's why it can be given in anaphylaxis. How is it given? So staff, इस drug को कैसे देते हो?
8 mg इन 50 ml NS या 100 ml NS में देते हैं। उसको जो रेट डॉक्टर एडजस्ट करते हैं उसके हिसाब से देना पड़ता है।
So very important point is it is not given bolus, it is given in infusion. Rate depends on how the BP is, and yeah. So this is about Noradrenaline. It is covered in amber colored bottle because it is photosensitive. Dobutamine. So Dobutamine is a mainly beta-1 agonist. So it is mainly given in cardiogenic shock, and it is also sometimes acts on beta-2 receptors. That's why it can reduce the BP to some extent. So it should always be given when systolic BP is above 90 or mean arterial is above 65 mmHg. Only then you should give Dobutamine. It is also covered in amber colored bottle. Adrenaline. So basically adrenaline acts on alpha-1 receptor, alpha-2 receptor, beta-1 receptor and beta-2 receptors. It's mainly used in anaphylactic shock, or it can be used in cardiac arrest cases. In anaphylaxis, it is given IM, and the dilution is 1:1000. So this dilution is 1:1000. If it has to be given in cardiac arrest cases, it is diluted in 10 ml of normal saline. So the dilution becomes 1:10,000, and then it is given IV. So IV in cardiac arrest, IM in anaphylaxis. So next drug which we have is Atropene. So Atropine is a anticholinergic drug, and इसको कैसे देते हो staff?
ये भी इंट्रावीनस दे सकते हैं और आईएम भी दे सकते हैं, और ये डायरेक्ट बोलस पुश कर सकते हैं.
So Atropine is basically given in bolus form. It can be given in symptomatic bradycardia or in conditions OP poisoning, and 1 mg to be given bolus, and it can be repeated every 3 to 5 minutes, and it can be given up to 3 mg, or depending on the condition we can increase the dose. Next drug we have is dopamine. So dopamine is basically the mechanism depends on the dose. At low dose it acts on D1 receptor, moderate dose it acts on beta-1 receptor, and even higher dose it acts on alpha-1 receptors. But it has a propensity to cause cardiac arrhythmias. That's why its use have been decreased now. Yeah. So these were the drugs. These all drugs which I showed are covered in amber colored bottle. और इसमें से स्टाफ इसमें ये सब ड्रग्स देते हुए कुछ पर्टिकुलर चीज़ जो ध्यान में रखनी चाहिए हमको.
नाम, पहले नाम और एक्सपायरी. कभी भी कोई भी इंजेक्शन देते समय फर्स्ट चेक करना है. IV IM जैसे लिखा है उसके हिसाब से ही देना है.